My name is Dr. Jacqueline Odhiambo. I'm a consultant physician at the Nairobi Hospital. I'm a diabetologist. So the main thing I do here is see the internal medicine patients, and I also run a diabetes clinic in the hospital.
Okay.
Yes.
Today we want to talk about weight loss and looking at what some of the things that people are doing in regards to losing weight. And one of the things that is now a trendy topic is Ozempic. So I would want to understand, is it Ozempic or is there any other word that covers it all, and what exactly it is?
Okay, so thank you for that. So first, the Ozempic is the original molecule, but the active molecule in that is semaglutide. We don't have Ozempic officially in the country because it is not registered with the Pharmacy and Poisons Board yet. So what we have are the generic forms of that and the different brand names from different companies. We have some Ozempic, yes, but it comes in through, I think we call it parallel imports, but it is not fully registered with the board itself. Yeah.
Why do you think that's a trend right now?
So weight loss has always been a big deal. And you know, before we'd talk about diet and exercise, and it requires a lot of motivation. The diet, keeping to a strict diet and exercising a lot. And that those people, even with the diet and exercise, they still don't achieve their weight loss goals. So when this molecule came in, it looked like a fast way of losing weight, because even without following the diet and the exercise, if you're using these molecules, you'll still lose the weight. So I think that is why it has really caught on, because it is, for lack of a easier word, for some people they consider it easier than diet and exercise, because it's just an injection.
Okay. Are these injections meant for weight loss, or were they originally meant for something else?
So originally, the semaglutide was discovered for diabetes management, but they discovered with time that even with diabetes management, these patients were losing a lot of weight, and so they started using it for weight loss management. So you find that currently it is used for patients with diabetes, but also for patients who do not have diabetes but need to lose weight, they can use these molecules.
Okay.
Yes.
Is there a likelihood that when you start using these molecules, you may develop diabetes at some point?
The molecule itself will not cause you to have diabetes, because remember, it is used to treat it, but as much as you're losing weight, it also develops on it depends on your other risk factors for developing diabetes. So yes, you can still develop it, but the other thing that it is used for is, we find that if we have patients who are in the pre-diabetes range, and we find that they are also overweight, then these are patients who also benefit from these molecules, because they will lose the weight. And we find that if you're in that pre-diabetes stage and you lose weight, it actually helps to take you out of that and back to normal sugar state. Yeah, so it doesn't really cause diabetes.
Okay. I'm curious though, what does it do to the body for you to lose weight? Because you know, when you go to the gym, we can see you gain or lose muscles. When you change your diet, we can see the effects. But what does, for lack of, let me use Ozempic because that's what is common, even though it's not in this country. That is what most people are using on social media. How does it work in the body?
So it works it is what we call a GLP-1 receptor agonist, and these are responsible for your satiety and that feeling of hunger and wanting to overeat. So it works on those centers so that you find that the people who use these molecules don't get hungry. So because they don't get hungry, they don't eat as much as they were before. And because they are not eating as much, then they find that they are not gaining weight and they are actually losing weight. Yeah.
Okay.
So that's the main way it works. Then the other main thing it does is, you know, hunger is when your stomach is empty, and when you eat, your stomach stretches and you're full. So what it does is it delays your emptying of your stomach, so that the food stays in your stomach for longer, so that when you eat, you feel fuller longer, so that at the end of the day, you end up eating less. Yeah, so those are some of the main ways that it works.
Okay. Is it safe for everyone?
So not everyone can use it, and that's why before you use it, you have to have a discussion with your doctors. For example, pregnant people, we don't know about it in pregnant people, so we don't recommend in pregnant people. Some age groups, 12 years and below, should not use it. Everyone should not use it without the doctor's approval, but especially those age groups. And also patients who already have type 1 diabetes. Yeah, it is not recommended for them to use these medications. Yes.
So there's this other concept where now we have celebrities who are using, again, for lack of a better word, Ozempic, because that's what people know. And the way they're showing their results is also influencing others to go and try using Ozempic, even without the doctor's prescription. What would you say about that?
So, like with every other drug, you usually have these over-the-counter drugs, like the Panadols, where if you have a headache or what, you can go take them, and those ones are sold over-the-counter because they are safe to use anytime. But for these drugs, they need to be used in a controlled manner to avoid complications and the side effects. Because what they don't tell you is the side effects of these medications can be very, can really affect someone's life. Because you see, the main side effects of this medication is vomiting, constipation, diarrhea, altered taste in the mouth, fatigue. So it needs to be introduced in a proper manner, and these side effects need to be managed properly so that the patient is able to benefit from the medication. So like everything else, when you see the finished product, there's a lot that goes behind the scenes, and if you don't use it properly, then you can end up with a lot of problems. So you shouldn't just use it like that. You should use it with your doctor, because if you just, because I think there's this trend where now we have even non-medical people giving the patients, in this case they are not patients. I understand now people can go to a spa and get the injection. So in that, I think they'll be a client, not patient. But what dose are you getting then? Because you also have to start at a low dose and then increase gradually as the person's body gets used to this medication. So for example, you're supposed to start at, let's say, 0.5 and you go to this spa and you get 1 milligram. Of course, the injection, the side effects are going to be more. How you react to the medication will also be different from person to person. And if you are one of the category of people who are not supposed to use the medication and you use it, then you'll end up in hospital. And then also remember that it's not a one-off injection. The patient has to use it for a long period of time to see the effects. So if you're going this week, then you go again next month and you're taking it once a month or once every 3 months, you won't get the benefits of the medication the way you should.
Okay.
Yeah, so it should be done in a controlled manner with the right people.
Is there like a specific timeline or duration for that? Like you would say within 6 months, you should be able to see good results.
Okay, so the timelines depend from patients to patients. There are people, even with the lower doses, you start seeing good results. There are people who you have to go to higher doses and you start seeing good results with that. But remember, it's not just the injection, because you have to combine this with your diet, and with time you also have to combine this with exercise. Because sometimes what this drug does is at the end of the day, you don't feel hungry. So you find some people have 1 meal a day, and there are some people who may even skip some meals. So if you're going to have 1 meal a day, this meal has to be a proper meal, because remember, you still need your vitamins, your proteins, your carbohydrates. So if you're having 1 meal a day and it's a small snack, then you find that these patients, with time, you start seeing they have nutritional deficiencies because they are not getting what they want. And that's why you need to work with that team, with the nutritionist and with the doctor, so that as you're eating less meals, we have to make sure that these are impactful meals that will still give your body what it needs.
Okay. So there's also this misconception that you can lose weight with the injections, but without exercising and diet.
Yes.
Like the whole injection is what is making your work easier. Is that true?
So yes, you can lose weight without the exercise and the diet with the injection. But the importance of the exercise and diet is one, in fact, we prefer before we introduce the injection, we've talked to you about your diet and even maybe your exercise, both of them, because as you do that, the injection, as long as you take the injection, yes, you will lose the weight. But if you stop the injection and you have not mastered the diet properly, then that weight will come back eventually. Yeah, and the whole idea is, yes, you may need to take it for a long term, but at some point you might want to come off the injection. So if you have not mastered the diet well and started exercising, because those are the things that will maintain the weight loss, and you stop it, then the weight eventually comes back.
So when you stop using the injection, you get your weight back?
Yes. It may not happen immediately, but eventually it happens.
So then does this not make it like a lifetime thing that you have to keep on doing?
So you find some people might have to do it might have to do it for a lifetime. And even when we put the patient on it, it's usually for a long period of time. It's not something you'll use for 3 months or 6 months. It's something you'll use for an year or even more than that. But when we are ready to take you off the injection, if you haven't gotten those other things proper, the weight will come back.
Okay.
So it's a long-term thing. Yeah.
And how affordable is this process?
So the medication itself can be a bit pricey, and especially the original is usually costs quite a bit. We have the generic forms of it, which are generally much cheaper.
Could you like give us range for the prices?
So like for the original, I can't because it's not in the main price list, but depending when you're on the full dose, some people might even be spending up to 300,000 a month or more when you're on the maximum dose, and if you're using it regularly the way you're supposed to use it. And when you come to the generic forms, then you might go to something as much as maybe 15 to 16,000 on the lower side for the lower doses. But when you're the full doses, depending on the brand, maybe 40 to 50,000. But this is just a range because remember, the prices keep on going up all the time. Yeah, so it costs a lot, and our insurances do not pay, most of them do not pay for it if you're using it for weight loss. They only pay for it if it's being used for diabetes treatment.
Okay.
Yeah.
I know not so many people are still open to injections. Like at the moment, we have probably the middle and upper class. Would you say this is something that is likely to be very common in the near future?
I think right now it's already quite common, more common than people talk about, because a lot of people are using this. But because obesity continues to be a problem in society and people continue to look for ways to go about it, I think, yes, even in the near future, it will be more common.
Okay. As a doctor, would you recommend that, or change of lifestyle habits and diet?
So everything depends on the patient. For everyone, lifestyle changes are important, because with this diet and exercise, it doesn't just impact on your weight, it impacts on your general health, the health of your kidneys, your heart, and everything else. So lifestyle changes will always be recommended across the table, regardless of what medical condition you have. And you find there are some patients who will start off with lifestyle, and they actually lose the weight to the point where they don't need the medication. and some people need the medication as an add-on. So lifestyle is recommended for everyone, but the medications are an add-on depending on now the patient's profile. Yes.
Okay. As you wind up, I want to re-emphasize on the process.
Yes.
Before you take it, because I know people really rely on what the information they get online. Some follow key people who they've seen actually use the injections and it's working for them. So without even going to the doctor, they believe they will achieve the same results. So what should one consider before going for the injections?
I think the main thing I would say is when someone decides that they want to lose weight, the first thing they should do is get in touch with their healthcare provider and see. Because remember, as much as the injections are there, they are not the only way for people to lose weight. And there are other things that we can also be more effective than even the injections, depending on how much weight you want to lose. So it's not a one size fits all for everyone. So what I would recommend is go see your healthcare provider. So your healthcare provider will evaluate you and see first how much weight do you need to lose. Second, some of this weight gain can be because of some medical conditions. And if you don't manage that medical condition, however hard you try to lose the weight, you will not be as effective. So then they check, do you have any other medical condition that needs to be managed? Then they link you up with the nutritionist. And sometimes you may also need a counselor depending on the state that you're in, so that this group of people now works together to find out which is the best weight loss plan for the patient. And this, of course, is with combination to the patient. So I would recommend, don't just start. Go see the right people, make sure it is the way, it is the method that is best suited for you, so that you can get good results. Yes.
Lastly, what are some of the misconceptions you've had about the semaglutide ways of losing weight, and if you can just debunk them?
So I think the main one is that the weight loss from semaglutide is fast. So the first thing is it is not always quick, especially when we start the medication, we start it at a lower dose. And with this low dose, people don't usually lose any weight, or if they do, not much. And this low dose is for your body to get used to the medication. As we go higher and higher with the doses is when now you start seeing the weight loss. So I think the main myth is that the weight loss will be instant. It is not instant. It takes time, and it takes also work on the side. Yeah.
Okay.
I think that's the main one. It is not a short-term solution. It is a long-term solution. You'll have to use it on a long period of time, with your diet, with your exercise, and under close follow-up with your team of medical professionals.
Okay. Can you get the semaglutide here at the Nairobi hospital?
Semaglutide is available in the hospital. You can find it in all major hospitals. It's available at the Nairobi hospital in all our pharmacies, but it is available under prescription only. Yes, cannot be bought over the counter.
If you want to lose it, let's say 10 kgs and then stop, what happens?
So even stopping, because you remember I talked about the lifestyle, because lifestyle, the diet and the exercise are the things that you'll use. They assist the medication in weight loss, and they also assist in weight maintenance. So even stopping the medication, again, you may not just stop it immediately. Depending on who you are in terms of your profile, your doctor might either decide to stop it or continue it for some time. Most of the time we maintain at that dose with the exercise and diet, and then we'll eventually stop it. But even if you lose the weight you want in, let's say, the next 2 months, we will not stop it immediately unless there are other factors.
Thank you so much, Dr. Harry.